He was a morbidly obese surgeon destined for an operating table and an early death. Now he's a rebel MD who is fabulously fit and fighting to make America healthy again. This is Stay Off My Operating Table with Dr. Philip Ovadia.
Hey, welcome back, folks. It is Stay Off My Operating Table with Dr. Philip Ovadia. I'm really looking forward to this one. And rather than spill the beans, I'm just going to say our guest is Scott Everson. From what I have been able to determine, he has a really cool story. And at that point, Phil, I'm going to turn it over to you.
Yeah, Scott does have a very cool story and is doing some great stuff to, I guess, build upon that and change a lot of other people's stories, is maybe the tease that I will give to it. I met Scott now a couple of years ago, was honored to be a speaker at the conference that he hosts, Meat Stock, last year, and looking forward to doing it again in 2026. And that's part of what we're going to discuss during this podcast. But before we get into all of that good stuff, let me give Scott a chance to introduce himself and give a little bit of the background as to what got him interested in health.
What got me interested in health is my bad health. It's pretty simple. I think a lot of people who are on your channel are here for the same reason. But I've never had heart disease. It did run in my family. My dad had a heart transplant. He died at the age of 61. My grandmother had congestive heart failure. She died, she passed away pretty early. My grandfather did. So heart disease definitely runs in my family. Myself, I ran into a lot of problems. Not very typical. I was taking benzodiazepines. I don't know if you've heard, I guess a lot of people in the community have heard of Jordan Peterson's
Yeah.
story with benzos, but I'll tell you that that drug is a nasty one. And I think really underrated. A lot of, opioids and these other psychotropic drugs and pain medications get a lot of attention, but not so much the benzodiazepines. So these drugs are absolutely deadly, and they completely just destroyed my nervous system. I developed something called mast cell activation syndrome, where I basically react to every food imaginable. I can't even eat aged meat or anything. That's kind of what got me started with carnivore. But what really got me onto carnivore, like I'd been dealing with extreme health issues for about 6 years, and Jordan Peterson's book came out, and he actually lived a couple streets down from me. I used to see them walk around my neighborhood quite a bit in Toronto. And then I saw him, I started seeing him on the news and everything else, and I was like, okay, I'm going to give this a try and see what happens. So that's basically how I got started with carnivore. I don't like to talk about my story too much. I'm trying to get away. I know this might sound a bit silly. I'm trying to get away from sort of being that sick person that identifies with my chronic illness. So I don't really like to talk about my story all that much, but my mission is to give people hope. And I think I've been the biggest sort of guinea pig that I know of for every type of treatment. I've been trying to fix my health for probably a good 20 years now, and I don't think there's a single treatment or protocol or diet that I haven't done. So I think in that time frame, just researching my own health, I think I've learned a lot. I started a community called Wired for Healing, and we deal with neuroplasticity training and trying to get people sort of out of that state of like fight or flight, which I think is pretty much everybody in our society these days. It's everybody deals with chronic stress, modern day life. And one thing I really like to talk about is social isolation. And so I've developed this community. We have Meat Stock, and I'm doing with some other businesses I started as well. So really, that's my story in a nutshell. There's a lot more to it, but I think we'll just keep it at that, not to bore people to death.
I'm gonna contradict you just a little bit here, Scott. One of the things that makes this show powerful is we have people who talk about what they dealt with, and our listeners will hear themselves. They'll identify with that. They'll say, "Oh my God, that's what I'm dealing with." And it helps them to take that next step. So, if you can, real quickly, just give us why were you prescribed benzodiazepines?
I was prescribed benzos for chronic pelvic pain syndrome. I had a
Chronic
lot of
pelvic pain.
some people might, yeah, some people might call it prostatitis. Some people might call it interstitial cystitis, vulvodynia. I mean, they all have these terms.
Right.
The umbrella term is chronic pelvic pain syndrome. I think it's all the same root cause.
Sure.
So I don't really differentiate. I don't think it's a lot of men actually get their prostates removed. It's kind of barbaric.
Yeah.
And I don't think it has anything to do with the prostate. It's usually a gut-related disease. So that's what got me started with the benzodiazepines. Yeah, and I've dealt with horrific, sort of gut problems and all sorts of neurological problems, and I still deal with to this day. So it's difficult, but I'm just kind of trying to live life as best I can, and I am strict carnivore. I've been carnivore for about 5.5 years, and I've been strict again the last 3.5 months. So all I eat pretty much is just a lion diet. So I mostly do steak, goat, lamb, a little bit of organs. And the only variation I do is a little bit of butter, and that's about it. So
Now,
yeah.
you mentioned about neuroplasticity, not something that we've
Oh no, Dr. Vadia, don't get me started. I don't want to bore people to death. You say the word neuroplasticity and all your subscribers are going to leave you. But
Oh,
I
no,
really
no.
we have a curious bunch.
I
I
have a
think
curious bunch.
we need to go into that one and talk a little bit about what that is and why, it may have impacts on people's health.
Yeah, okay. So neuroplasticity is a very broad term because some people call it like limbic system, a dysregulation or nervous system dysregulation, whatever you want to call it. It could come about from chronic illness. It could come about from really anything. There could be trauma in your past life. It could just be from chronic, everyday modern stress, just working a job, not feeling like you have purpose in life, dealing with relationship struggles, community, all sorts of things. And, before we used to think our brains were kind of cemented in this sort of, not a plastic state after the age of 8 or whatever it was. But we've since learned that there's a lot of room for recovery, that there's a lot of room to I guess just make your brain neuroplastic and changing the matter in your brain just through thoughts alone and doing different practices. You hear like Benazzati talking about gratitude. It could be just changing your thinking patterns, changing your perceptions on things, even, lifestyle stuff. It could be meditation, it could be breathing. I mean, there's so many different things that go into neuroplasticity, but I mean, that's kind of it in a nutshell. It's not something I really like to talk about because I think people aren't super interested. But if you guys are interested in learning about neuroplasticity, I highly recommend checking out Joe Dispenza. He's kind of the master on that, and he has a lot of great content on YouTube. But I really like to talk a lot more about community and how that plays a role in health. And that sort of ties into neuroplasticity as well. And just speaking about heart health, I was doing a little bit of research before I came on here. And I was kind of blown away with some of these studies that are out there on loneliness and feelings of isolation. It's absolutely incredible. Like, even if you're looking at like heart disease, I don't know if you know about this, Dr. Vadia, but loneliness has, according to one study with 2.2 million cohorts, led to loneliness. A feeling of loneliness led to a 29% increased risk in heart disease, 32% increased risk of stroke. They compared it to smoking 15 cigarettes per day. It also led to,
The feeling of loneliness and isolation.
yes. So you're looking at about 30% increased risk of heart disease. Now, obviously, we know that these studies are not exactly perfect science. There's a lot of confounders in there, but
Sure.
I think it's still pretty interesting. And it's a high enough number to take note. It's not like some of these studies you see on the carnivore diet. Oh, you eat, red meat, you have a 1% after adjusted risk of heart disease. It's just complete nonsense. I thought that was super interesting. 40 to
Yep.
60% cognitive decline. People who felt a sense of loneliness. They saw improved scores on pretty much every level, physical and mental health, in people in retirement homes when they started implementing more social programs. So there's a lot of data out there on the impact of loneliness. I think that's a huge problem in our society today, is that we all kind of just live on our own. If you look at ancestral cultures, they all kind of live in these like sort of cuddle puddle type habitats where the communities all know each other. You have families of a dozen people living in one small room. They all sleep together. They don't have sanitation that we do. They have much more robust microbiomes, much more robust immune systems. So I think there's a lot of problems. I think a lot of it is the way we go about communicating in a modern world with social media and technology. I think of it some of it's self-induced as well. I think a lot of people deal with stress by isolating themselves. I know I used to do that as well. We make it very easy for ourselves to isolate ourselves now as well. We could order everything online. We don't even have to go out anymore. We don't have to do grocery shopping anymore. We don't even have to leave our house ever, ever. Plus, we have all this entertainment and everything. So I really think that it's something that's not a very sexy thing to talk about. It might not interest some people. I think sort of the hot topic buttons in our community are talking about mold toxicity or talking about heavy metals or diet or and sort of these things that you could suggest a protocol for, but it's very rare you get a prescription for more social time. Join a group, hang out with people more, hang out with your friends, do something. And that's sort of what I like to talk about. That's the whole reason why I started Meat Stock, because I felt like I didn't have enough like-minded people. I could tell you guys that when I started going to events, and I think everyone in this community knows who Dr. Kiltz is. I like to joke, I see Dr. Kiltz more than I used to see my ex-wife. But when I started going to these events, I could tell you that was the most healing medicine for me of anything imaginable. Way more than diet, way more than lifestyle. I would come back from these events feeling so much better. And I think a lot of that does tie into this sort of fight or flight system that we're always in. We're always, waking up in the morning, getting our kids ready, going to school, getting them ready for school, going to work, coming back, feeling like we don't have purpose, feeling isolated, blah, blah, blah. And I think this is like the case for almost everybody in our society. So I think we need to get back to living more in a community, identifying with like-minded people and just getting together more often in person. Just a lot of these studies also show that just doing things virtually, it just doesn't cut the mustard for increasing your social time and reducing loneliness. So that's kind of what I'm all about these days.
So you
Yeah,
you
you know,
started Meat Stock because you wanted to be around like-minded people.
Yeah, I mean, I started off doing retreats. I started off doing at cost retreats where I wasn't even making money. Actually, most of the time I was losing money on them. I just wanted, honestly, it might sound kind of crazy, but I had friends here. I think a lot of people here could relate. I had like my kids like daycare, friends' parents who I would hang out with, and we'd talk about our kids. And I don't know about you guys, but I've always kind of been different. I've always kind of felt like I'm sort of living in the Matrix or something, and I'm just this kind of weirdo that thinks differently than most people. And I think that's maybe kind of what attracted me to the carnivore diet. And I think there's a lot of people in our community that sort of think outside the box. We're kind of the weirdos and for lack of a better word, I think, we're kind of weirdos among the sort of general populations. I don't know. It just wasn't giving me the satisfaction I needed from a social aspect. And I started hosting these at cost retreats just to hang out with like-minded people. And then you start inviting special guests, and that just kind of grows from there. So I find it like a lot of fun. I mean, it's stressful, but it's a lot of fun for me. And that's why a lot of time I go to every event I could find, in our space. Yeah.
yeah, I mean, I certainly would agree with most of your sentiments. When we talk about the power of community as it comes to health, when you look at things like the Blue Zone studies and you look at even the Mediterranean, diet, right,
Oh,
as
big
a
time. Yeah.
benefit for heart health. And, you very quickly, if you understand, what's going on in these places, right? Community is a huge part of that.
Oh, huge. Like Loma Linda, the Okinawans and Italy. I mean, it's all about family. It's all about family and community. And that's something that we lack here in North America for the most part. So I think that religion could be beneficial for a lot of people because religion breeds community. But, for the average person, I mean, we're not getting any more social time. It's horrible. And I think that there's enough evidence out there. But, I think that a big reason why I take so much interest in this, because I blame my own illness on that. I think that my chronic illness started from loneliness. When I first got sick in 2000, when I really got sick in 2016, I often ask people, like when I do coaching, I always say, what happened to you before you got sick? I find that funny. It's, I don't mean to crap on doctors, but, you go to any family doctor, they'll
We
never
we
ask
we
you, what.
crap on doctors on this show.
Okay, well,
Don't
I know
apologize.
that. Yeah, I know Dr. Vadia. I feel like enough now to know that he doesn't really follow the mainstream on a lot of things.
Nope.
But yeah, you never go to a doctor and they say, what happened before you got sick?
Yeah.
It's always just, oh, what are your symptoms? If you really want to get to the root of something, you ask people what happened before you got sick. A lot of times, I'll tell you, a lot of times it was social isolation, and that's exactly what happened to me. I just moved cities. I left all my friends. I left my work. I changed everything up. I mean, there's some other stressors there as well. But when I moved to Toronto, I was kind of in the big city. I didn't know a single person. And yeah, I just felt very isolated and I felt depressed. And depression leads to all sorts of problems. So gastritis, and then gastritis leads to low stomach acid. You get overgrowth, you get leaky gut, and the snowball just goes on from there, right? So I think, social isolation is like the root cause of a lot of people's problems. But
I
really
would
at the
like to
root,
I want to just stop you right there and
yeah,
just
sure.
put a pin in this and speak directly to the audience. Scott just said social isolation was he thinks it was the root cause of his physical problems, which
Oh, yeah.
then cascaded into psychological slash mental problems.
Oh, big time.
And without that isolation creates stress, and that stress manifests in all these physical, psychological, mental,
It's
maybe
it's
even
well,
spiritual
what do we
problems.
do? What do we do when we put people in isolation in prison? It's torture. It's like they torture people with social isolation, and we do it voluntarily. I think there's a lot
Yeah.
of people. It's
That
like
wild.
it's crazy. It's absolutely crazy, and we're pretty much, I could tell you, like, I've traveled the world, and I'd say we are the worst. Here in North America, we are the worst for voluntary social isolation. But, but if you look at, okay, so what does it do? It causes stress, right? Which causes nervous system dysregulation. What does stress cause? It causes an inflammation. Okay. And then that would explain why, heart disease, cognitive decline, inflammation is linked to pretty much every disease on the planet. But I can tell you for myself, it led to gut issues. Gastritis is extremely common, but gastritis is way worse if it's chronic and it gets really bad, right? Gastritis leads to low stomach acid, leads to all these overgrowths, leaky gut. Like I have 10 different overgrowths. I have Klebsiella, I have C. diff, I mean, a million different things. So my next course of action, just due to stress that I had 10 years ago, I probably have to get a fecal microbial transplant. And that's all rooted from stress, from social isolation. And then obviously the benzodiazepines and the psychotropic drugs was sort of the final nail in the coffin. But I think it's something that, like, it makes me a little bit angry because, when you go to your doctor, it's always, here's a pill. Oh, you're depressed. Tell me about your symptoms. It's always never what's causing your symptoms. And I can tell you, I've never had an experience like that. I know Dr. Vedi is one of the great doctors out there. A lot of people in our space are, but I'd say the general mainstream medical practice is to not look at the root cause. And even, I would say, even in the more the functional medicine realm as well, alternative medicine, whatever you want to call it, it's always something looking. There's always a bunch of rabbit holes that you go down. And I've seen this in recent years. I don't know about what you think of this, Dr. Vadia. We see this massive movement with mold now. Everybody's mold toxic. Every single person, you do a mold test, you're toxic with mold. You got to move out of your house. You got to do this, you got to do that. You got to spend $30,000 on treatment or whatever. And I just think it's so less complicated than that. I'm pretty much off all supplements. I refuse to take any drugs. I won't do anything because I really believe in our body's natural ability to heal. I think we are healing machines. Like after all the dealing for the last 10 years with hundreds of symptoms pretty much on a daily basis, you look at my neighbor next door. I mean, God, you go to her house. I live here in Florida, close to Dr. Vadia. All of her windows are covered in mold. She's been smoking for 63 years. She's been living off of Ensure for 20 years because she doesn't like to cook. So she has about 5 Ensures a day. And she's okay. Our body is the most powerful thing in the world. And why some people get cancer when they're 30 and some people don't, I don't understand that. Is there maybe some genetic component? I have no idea. But I don't think so because when you look at ancestral communities, they have no incidence of cancer. Is it a microbiome issue? Is it a bacterial issue? There's so much that we don't know. I find it very interesting. I'm just like, this is something I just look into every day. I just love studying ancestral cultures. I'm just trying to live as naturally as I possibly can. And yeah, I mean, that's when people come to me asking me for advice. That's what I say. Let's not add things. Let's strip things down for treatment. Let's look at diet. Let's look at lifestyle. Let's look at stress. Let's look at getting out in the sun, and we could go from there. If try that for a year, if that's still not working, then look at the alternatives. But I think we overcomplicate our health way too much.
I'm a marketer in real life, so this just occurred to me. I've talked about the secret to health is the four S's: sun, steak, sleep, and
Yeah,
steel. But
love
I
it.
hear a fifth one:
What's that?
socialization.
Socialization. There you go.
Way to
There you
make it
go.
an S.
Well, don't you guys feel better when you're with other people, like people you like?
Yeah, there's no doubt, that, these things that you're discussing, right? The community is a vital part of our well-being. And you're right, it doesn't get recognized. And
Yeah.
in a similar fashion to, we talk about stress, right? But you can't really measure that per se. It doesn't get factored into the equation. And I think community, goes hand in hand with that. And it even within the medical system, I think there's always acknowledgement of this, right? We talk about, if for instance we know, right, that just talking about your family support system, right, and how that impacts health outcomes, and there are
Right.
volumes of studies, right? I know there are plenty of them in the heart disease space, but other disease states as well, right? That just a simple thing like, if your family comes to visit you in the hospital, you're going to do better, right? Then
Oh, yeah, there was a study done on that too. Yeah. It was something like 50% better outcome for health and hospitalization as well. I mean, that's just crazy. I know again, it's not a very scientific study, but at the same time, I think it's like the numbers are high enough that you have to take note of that, you know. So,
yeah, certainly, like you mentioned, the effects that are seen in some of the studies like this are of much greater magnitude than some of the things that we talk about as gospel, right?
yeah.
Cholesterol lowering medications, as an example, that have, effect magnitudes that are much lower than some of the things, you've mentioned.
Yeah.
It's one of those things, right, that medical practitioners, I'll talk about the doctors, right, give sort of some lip service to, and they sort of may, they'll talk about it but they don't really focus on it, right? It's just one of those things that just sort of gets thrown out there. Oh yeah, you should have a strong community and you should be on a good diet, but take your medicine, and that becomes the focus of the visit, and the other stuff just gets ignored, largely gets minimized, I'll say. That we as doctors don't believe that this can have an impact, right? Because like you said, we can't prescribe it. I can't give you the protocol for it per se. I can't test for it. I can't draw your blood and figure out your level of community, but
Right.
that in no way minimizes its impact.
Yeah, but absolutely. But I mean, if you believe these studies, Dr. Beatty, I mean, a 30% increased risk of heart disease over, a long period of time. I mean, that's pretty significant if that's true. I mean, that should be like heart medication right there. Hey, go make some friends and hang out, watch the baseball game or eat a steak or whatever you do. You know? So I think that's something that should be talked about a little bit more. I never really hear about it too much. So I could just say that I think if we're going to heal, if we're going to heal ourselves in this area of the world where we are the sickest, America is one of the sickest countries in the world for its,
Yeah, we
for its,
spend more
for
and
its,
get
yeah,
less
for
on
its,
healthcare than
yeah,
any developed country in the world.
yeah, especially for such a wealthy country as well. And if we're going to heal ourselves, we talk about food, but we also have to talk about community. We have to bring this back into our society. And whether unfortunately religion is really dying off quite a bit, and that's where a lot of our community came from. So we're going to have to find other ways, And part of our thing is I'm not trying to plug my event, but like going to anything, going to different meetups or events or whatever, whatever you're interested in. It doesn't matter if you're interested in ponies, go to a pony event, do something, talk to people who are like-minded people. It's one thing to hang out with people, it's another thing to hang out with like-minded people and people that could understand you and that maybe have gone through different things. But another thing that ties into this is purpose, right? And the beautiful thing I could say about the carnivore space is that we all share the same mission. We want to get people healthier, right? And when you share a mission with others like that, it gives you purpose. And that purpose comes part and parcel with the community. So it all ties in together, And yeah, I don't know. I don't know if people have tuned me out by now. I don't know if it's, you know, I don't know if it's something that people are really interested in hearing about, but I think people should do more research on this and take a look. I could throw some more controversial stuff in there for you guys. Totally up to you.
We'll definitely get into it, but I think I'm going to declare here publicly, right, that Meat Stock is going to be the first conference to be prescribed by a doctor to
Prescribed.
their
Dr.
patient.
Vadia is
Yes.
prescribing you to go to Meatstock. He's pulling out his prescription pad. It's going to be the biggest carnivore animal-based conference of all time. I could promise you that. I think it's an exciting event. And we pretty much have everybody come into it in terms of the animal-based and carnivore space with some extra people coming as well. We have Callie Means coming, some people who are kind of like in charge of our health. And that was kind of a big idea I had of this event is I really want to marry the carnivore crowd with people who can really have an influence to change things. I want Dr. Vadia. I know Dr. Vadia is in there. I think you have done stuff with the whole Maha group and everything like that, but let's all get together, and all these like-minded people. I mean, there's a lot of people in the Bitcoin space that love beef and just anyone who thinks differently about our society and how we live and is trying to get healthier. Let's all come together. It doesn't have to be meat stock, but if you guys want to come to meat stock, I think it's going to be a lot of fun. We have a lot of cool stuff lined up. It's less of a corporate event. We get musicians come in. I have swing dancers coming from Poland. It's pretty unique. It's kind of a fun Americana type event, but
Why
enough about
why
meat stock
Gatlinburg, Tennessee? What's
because
that all about?
it's the best place to have retreats. And with meat stock, I really like the idea of having all the speakers living together. And I thought that they would really enjoy that. So yeah, all of our speakers we're gonna have a big lodge near the convention center. And we're all going to eat dinner together and wake up and have breakfast together. And you could do the retreat part with the attendees as well. So you can pay a little bit extra to live sort of among the speakers and get that special time with them. Unfortunately, we are sold out of the retreat part, but we still do have convention tickets left. So if you guys are interested, you just go to meatstockconvention.com and you could check that out. But I would like to talk about a couple more things. If you guys don't mind me, I'm kind of an annoying guest. I warned Dr. Vadia of this. I said, don't have me on because
That's all right. I'm an annoying
I'm
host, so
I'm
we're in good shape.
yeah, I'm very ADHD and I bounce around from place to place and I can't keep my thoughts straight for more than 10 seconds. So here's one that's going to maybe blow your mind, okay? And I think this is going to start becoming viral in our community a little bit. There is one thing that most carnivores are eating that could potentially be very toxic. Can you guys guess what that is?
I'm hoping it's not steak.
Dr. Vadia, do we have a guess?
I'm gonna go with I'm gonna go with that you're getting it milk, maybe.
Dairy could be one thing. That is controversial. Let's just say that dairy, if you look at it from an ancestral sort of biological perspective, I mean, it's more meant for feeding, fattening up infants, But hey, I like dairy, teach their own. There could be worse things to have. So I'm not anti-dairy at all. I love my butter, so no one's going to tear me away from that. But no, I'm going to say salt.
Oh,
Salt.
that's
Now, I'm
that's
not
definitely
saying
going to be
salt.
controversial there.
Now, I'm not saying salt is bad for you, but I will throw in that it depends on the salt. And I think unfortunately, the salt that has really permeated the carnivore space are some of the worst salts out there, and they've really done a good job with marketing. But a lot of testing has come in. We've run our own lab tests on some of these salts, and they are extremely high in a lot of pollutants.
Which
People
ones
that
are we
might
talking about? Let's name names.
We could name a few, like Redmond real salt's probably the most common one that we use in the carnivore community. They tested very high in lead. They tested high in lead, arsenic, cadmium, all sorts of neurotoxins that are, I think the lead content was 5,000% over the recommended daily intake per serving. So our country doesn't really have guidelines on heavy metals, but if you're looking sort of on more of the European consensus guidelines and stuff like that, some of these salts just blow through the roof. Redmond's really bad. Celtic salt, I think, was ended up one of, if not the highest in lead content. Lead is a pretty much a forever pollutant. I mean, it's everywhere. We do get in trace amounts of lead everywhere, even in the air. But to willingly putting it on our steaks every day, especially at the levels that are found in some of these salts, could be quite dangerous, especially over the long term. And Baja Gold. So a lot of the carnivore salts are really ones that I try to avoid at all costs. There's a lot of lab analyses that have come out in recent years that are sort of showing what are some of the better salts and some of the more dangerous salts. But I think in the carnivore community, we've all kind of rallied around the most dangerous ones out there. So I would say that's one element.
Okay. You can't drop a bomb like that and not give our listeners a way to protect themselves, defend themselves, do something smart or do something different.
Well, okay, there's a good friend of mine who runs a website called Mamavation. There's also is it Lead Safe Mama, I think, as well. But Mamavation, so they're great. They run a bunch of independent studies on all these products. It was originally ran to test kids' foods. And they started by testing like infant formula and all these, baby foods like teethers and stuff like that to check for contaminants, which they did find a lot of heavy metals in a lot of these foods as well. The way that we're talking some of these infant formulas and teether products and stuff that have, 20,000% the RDI for arsenic and these other things. So they started testing these things. Now they test almost everything. They're testing all sorts of products now. It's all nonprofit. They don't make any profit on this. So that's one website I really trust, and they
What's the
do a lot.
website again? I didn't.
It's Mamavation, Mamavation. Mamavation. So
Oh,
you can look up on
motivation.
there. It's a great resource. It's a great resource. And they're all independent lab studies. They don't conduct their own studies or anything. So there's no
Motivation.com, non-toxic products for
Mamavation.com. Yeah.
healthy families. All right.
Yeah.
Thank
Yeah.
you.
So
Yeah. So that's a friend of mine that runs that, and she's great. And she lists a bunch of salts on there that are safer alternatives. Now, some of the safest alternatives are actually table salt, which I don't recommend. But I think some of the worst are these landmine salts. Landmine salts have typically the most dangerous levels of pollutants, even though sometimes they can be better in microplastics and other things like that. But, if you could find a good sea salt, they typically do a lot better. It depends which sea we're talking about. I wouldn't do sea salt from anywhere in the US, but Norwegian sea salt's really good. And then there's other things, I'm just going to say this, one thing I loved that Anthony Shafee said is, there's no other diet on the planet for any other species out there that we consume that like rots their teeth if they're on their natural diet.
Huh.
And that was kind of his case for the carnivore diet, you know? Really,
Yep.
and that's such an amazing point. I've reversed my gingivitis. Like, why is it that the 5% carbs that I had in my diet, I had a little bit of white rice a couple times a week and some fruit, and that kept my gums bleeding. And it kept my gingivitis kept going. Whereas doing carnivore strict for 3.5 months, my gums don't bleed anymore. I went to dentist. She's, wow, your gingivitis is a lot better. Your gums aren't receding as much. Isn't that a great point for carnivore? I thought so. Anyway, I had to throw that in there. But he also talks a lot about stevia. And I know there have been studies on mice. It's not the best, but showing that does act as, and some societies have used it as a contraceptive for birth control, stevia. So it's one of those things, doing a lot of these flavored electrolytes could be a problem for some people as well. Some of these products, I will say, I'm going to throw shade at Element. It's not a very clean product. And they use a lot of kind of crap in their ingredients. They use table salt, they put maltodextrin in there. If you're fasting, it actually breaks a fast because I think they have over 2 grams of carbs per serving. So technically, you are breaking a fast if you drink Element. So there's a lot of things that people are doing in the carnivore space. I'm not saying that you have to be super strict, teach their own, but there are these like little things that people are doing that, where we think we're doing our body good, but I think people need to be a little bit more careful. If they're really sick, like I've been, and they're really looking to optimize their health, really maybe cutting out some of these things. And if you're going to go carnivore, I say go full in, because I'll tell you, even if you're 99% carnivore, you do 1%, and you're really sick and you got these gut issues or whatever you have, that 1% could be preventing you from healing. And I am a case study of that.
Phil,
So,
comment on that.
yeah, I want to
Well, yeah.
kind of understand, I guess, here's Scott's framework, right? Because we started the conversation kind of saying, simplify your life, right?
Yes.
And now we lead into, and I think this can be applied to a lot of things, right? The people, that discuss the differences between, grass finished beef and grain finished beef. And, should you be eating chicken or pork that's conventionally raised, right? Versus, and, ultimately we get into this scenario, right? That I think some people, they end up in a point where they're just like, okay, there's like nothing for me to eat, right? Because everything, if you look at it in a certain way, has some, toxicity associated with it. So I'd love to hear kind of your framework for evaluating, okay, when do we worry about these things, and when do we kind of give it a pass and say it's the best option available to us,
Yeah.
on a reasonable basis.
I don't feed my kids that way. Okay. I don't feed my kids the way I feed myself. I think that your body, yeah, I understand what you're saying. So I think that if you are relatively healthy, or, you don't deal with symptoms on a daily basis, whatever, I think that people are too scared in our community of, just foods or toxins or whatever. It's like they almost want to put themselves in a bubble because they're so scared of everything.
Yep.
Your body could take tremendous abuse. Like I talked about my neighbor smoking for 63 years, living off Ensure for 5 years, or 10 years, or whatever she's been doing. Your body is a powerhouse for processing toxins. That's what your liver, that's what your whole body, all your organs are for. That being said, if it's life or death and you're living with chronic illness, you have these gut issues, which a lot of people in our society, if you live with leaky gut, a lot of people have that. You have SIBO, you have mast cell activation, you have histamine intolerance, you have all these different things. It's almost like playing a video game. You cannot cheat ever, not once. I'm telling you, when it came to a lot of my symptoms, and just speaking of like even my gingivitis, everything, just keeping those tiny amount of carbs, a little bit of white rice here and there, a little bit of fruit here and there. That's all it did to keep me going. And I saw no healing with the carnivore diet doing it that way. Zero. So for me, I think part of the reason for that is, you really look at a shift in the gut microbiome. And these gut bugs, just like cancer, can live off the tiniest little molecule of carbohydrates and can ferment glucose to survive. So I think when you cut off that source and you're running on ketones and you don't feed certain bugs, these overgrowths, which usually feed off of sugars, they start to die off, and then your beneficial gut bacteria start to take over. It's also a matter of also eliminating the anti-nutrients, right? You start eliminating lectins and oxalates and saponins and salicylates and all these chemicals found in plants to protect themselves. It also gives your gut a chance to heal because you're reducing the inflammation. And yeah, so I think the carnivore diet is super beneficial, but I'd say one thing I would say with the carnivore diet, I don't know how conducive it is. I'm sort of torn between, should you be long-term carnivore? Is it actually healing you? Do we perhaps need to take a more of a gap style diet approach and maybe, introduce ferments or introduce fiber at some point to try to build up your beneficial, whatever that means? I mean, I think we know as much about bacteria as we know about Mars, but I think that, I'm really trying to learn this and I'm trying to just sort of think, I'd love to get your thoughts on that. What do you guys think? Do you think carnivore long term is just the ideal way to sort of heal and prevent reoccurrence of illness? Or do you think maybe we should be trying things out? Should we be getting some fiber in our diet? Should we be doing some kefir or whatever, like Dr. Romero suggests? What are your thoughts?
Yeah, I generally do encourage people that, I don't think of the carnivore diet as the strict sort of, I guess, maybe it's more of I fall into the animal-based camp, right? That I think that these foods should be the majority of our diet. They should form the base of our diet. But I do think for most people, adding some of the things in that you mentioned can be beneficial. I think, as you said, there are some people that, yeah, they need that absolutely strict version of the carnivore diet, at least for a time being, right? Until they heal things like the gut and the microbiome. I'm always hesitant to, I think the microbiome can lead us down it can lead to a lot of misconceptions, right? Because a lot of the research that has been done around the microbiome came in with an assumption of what a healthy diet is. And then they looked at the microbiome of those people and they said, okay, this is a healthy microbiome. And that may look very different than, for instance, the microbiome of a long-term carnivore. But we don't have the evidence to say that one is truly better or worse than the other. And I think that, has led to some misconceptions, ultimately around things like fiber and how important it might be. It's interesting, you bring all this up. It's certainly stuff that I've been thinking about, and shameless plug, it's something that's going to be discussed in my upcoming book. But my thinking on it, I'll say, has evolved, and maybe that's the most important lesson to be learned here, right? If we lock ourselves into, we're convinced that whatever it is the absolute right thing and the only way to do things, I think that's where a lot of the danger around health comes in, and we see it on both sides. I can certainly point to a lot of things in the sort of mainstream medical community and a lot of the answers that have been put forth as this is the answer and it should not be questioned and cannot be questioned. And I don't think we want to fall into that, within our community. And yes, I hesitantly agree that sometimes that does happen, and I do my best not to be that dogmatic. And, just circling back to the conferences and the community, the reason I keep showing up at these things is because I learn something new every time I'm at one. And, you and I were just together as we're recording this last weekend at Hack Your Health. And I heard a couple of great talks there and started, which opened up my mind to a couple of different aspects of all of this. So in the end, we all need to keep learning, and we learn a lot from each other. One of the things I mentioned in my talk at Hack Your Health was how much I learn from my patients on a daily basis. And I think if I ever stop doing that, that's the time that I should stop being a doctor, because, and my patients are probably my greatest source of education.
Can I just jump in for a sec? So I'm very curious, okay? I have to ask you this because I love to get all the doctors' different thoughts on this. But there was a woman at Hack Your Health who's a friend of mine here in St. Petersburg, and she brought in her labs, and it was probably the highest overall cholesterol score I've maybe ever seen. I'm sure you've seen higher, but it was in the 800s. And I don't know if she talked to you or not, but it was in the 800s. And same with the retreat I did in Montreal a few weeks ago. I see these numbers creeping up, LDL is going up, which, doesn't really matter, but it's more the concerns when you see the triglycerides creeping up. The HDL is very low. Like some of these people on a car, and I can't figure it out. I don't know. Like the HDL is 30 something or 40, and the triglycerides are 400, and I don't know what your thoughts. I've heard things about lipotoxicity. Like I know Dr. Ali's talked about this a little bit. Maria, the Emmerichs have talked about it, like where you're consuming beyond your body's threshold for fat, and it actually spills over into the blood, and could accumulate in your heart and different organs or whatever it might be. I've heard of some people getting fatty liver on carnivore, and I could tell you like my LDL's through the roof. I mean, typically my overall cholesterol is usually in 600, but my HDL is also usually between 80 and 90. My triglycerides are in the 30s or 40s. If you believe all that stuff, I don't know what to believe. I'm going by the sort of triglyceride to HDL ratio. But I mean, what do you think about these other people? I know there could be other stuff like stress and stuff going on, but man, I don't know too many people that have more stress than some of these people who I know, like myself and some of these other people that have been living with severe chronic illness for a long time. And my tests are fine. Some of these people are like Dr. Kiltz is as cool as a cucumber, and his numbers are getting worse. So what is the factor here that's causing some people is it genetic? Do you have any thoughts on that? I know you do, so that's why I'm asking you, but.
Yeah, and I end up seeing a lot of these patients ultimately within the community. And like I said, I don't think there's one answer. I think you do have to consider, are you eating too much fat? Or maybe, the forms of the fat that you're eating, right? I think in a lot of people, when you're looking at the liquefied fats and the butter and the, butter in your coffee, and, that can become problematic maybe in a different way than, eating the fat of the animal does. So always hesitate to put it into a broad category like lipotoxicity. Yes, I think that's an issue in some patients. Of course, there's been talk, I guess, on the other side, right, about this maybe phenomena of too low an insulin level. And is that a problem? And who is it a problem for? Right? This is where it gets real sticky. And I think ultimately, what it leads me to is we certainly can't assume that just because we're eating a good carnivore diet, everything is all right. This is, I think, the biggest maybe danger and the biggest sort of messaging that I have trouble with in our community is that sometimes, the message comes out as, just eat meat and everything will be all right. And, clearly that's
Sounds like a Bob Marley song.
Yeah, exactly. And, that's where I think the trouble comes from. And I think it is important to be looking at your labs. And when you see things like some of the things you mentioned, yeah, that has to alert you to what is going on there. And, what is going on might be anything from something you're eating to the way that you're living, circling back to what we were talking about earlier, the stress, the sleep, the sun, the community, right? All of this comes into play. What does your microbiome look like, right? It all comes into play, but I don't think there's always a simple answer to it. And, I guess this ends up sounding like another sort of shameless plug, which I don't want it to be. But those are the situations where finding a practitioner who really understands this. And listen, that may not be a doctor, right? That might be, one of the fabulous coaches, naturopaths, chiropractors, keep going down the list, right, that are in our community. But you need someone who can think deeply about this, give it the personalized attention that it needs. Because if it was as easy as, just plug it into the algorithm and the algorithm will figure it out, then, we would have it solved by now. And clearly we don't.
There's just chat GPT, right?
Yeah. Yeah, exactly.
Maybe you could talk a little bit about that at Meat Stock. I'm going to plug Meat Stock. I'm pretty much giving the worst plug for Meat Stock ever, though. I should just be like, yeah, Carnivore fixes everything. We're good to go. Let's just talk about great carnivores. I think Carnivore is great, but I think that it's not panacea. It's not just doesn't work for everybody. I think it's silly to think, oh, you just need a carnivore harder. There's some cases where, and maybe the majority of cases people go on carnivore. It seems like it, where people do amazing, but it's not always the case. There have been people on carnivore who've had heart attacks 5 years into carnivore, and they say it's probably from all the damage I did before carnivore. You don't know that. That's just a guess. And if that was the case, then maybe, if you were carnivore for 5, 6 years, I mean, you think that would have reversed some of that damage to the point where you wouldn't have a heart attack. So it's interesting. I find it all very interesting. And it's something that I just think about all the time. Like, why is it some people do this on carnivore, some people go the other way? Why is it the majority of the people, their microbiome flourishes on a carnivore diet, and some people will just get this complete, collapse of their microbiome. They get really sick, which is rare, but you just see a lot of strange things. So I think we're all very individual, and
I spend every day questioning why my hair hasn't grown back yet, but here we are. But yeah, like I said, I think it is a great plug for Meat Stock and
yeah.
coming together and hearing from, really the amazing lineup of speakers. And I encourage people to go check that out. I'm sort of humbled to be included on the list there.
Yeah. You have your book. When's your book coming out?
It's going to be coming out in July of 2026, so it will still be in the pre-order phase then. So we won't be ready for book signing, but we can. I'll be talking about what's in the book certainly, and I think it's going to be a great conference. We should give people the details. May
we
2nd
should.
to 3rd, right? Is the main
May 2nd, 3rd. Yeah, that's right. Jack, are you coming?
I am tentatively. I'm about a 40% yes on it at the moment.
Okay.
I've had had a high school friend, haven't seen him in years, who out of the blue called me and we got to talking about what we're doing in life. And he mentioned that he'd gone to the last Meat Stock and he's going to the next one. And he said, yeah, you should come to Meat Stock. And, there's a part of me that thinks,
absolutely.
Dear God, I don't want to see
guest.
somebody I haven't seen in that long. He's going to look old and I don't want to.
Oh, come on. Look, I'll get you signed up. You'll have a ticket waiting for you there. And how about if we did something like this? I'm just throwing this out there. We didn't really talk about this beforehand, but how about the first, maybe we could give some kind of code, and the first, 30 people that use the code will get a free book, a new book from Dr. Vadia that I will include with their Meat Stock ticket. So how does that sound? Maybe something like that? Can we work that?
Sounds like a winner. We're going to put code iFixHearts in there, and you heard it. Scott's buying your copy of the book.
I will buy a copy for the first. I'll buy a copy for the first 50 people that buy your new book, iFixHearts.
That's signing up at the
and we will have
tickets at Meat Stock. Okay,
yeah, that's right. Yeah, go to meatstockconvention.com. And you guys check out the speaker lineup. I know I'm shamelessly just plugging everything right now. I do have a new
I checked out the speaker lineup and I went down through there and I went, oh my gosh, they're coming. Oh, he's coming. Oh, she's coming. Oh, we've had her on the show. We've had about half the guests, half the speakers have been guests on the show. So that tells me we've still got to get the other half on the show.
I think we're going to have between 1,500 to 2,000 crazy carnivores there. And I will do a shameless plug. I do have a new electrolyte business out there as well. Really clean product. You want to check out livesalter.com. I'm sorry
that's what your hat is.
I'm horrible today. I'm just plugging everything. I'm sorry, Dr. Vadia. This is the last time officially I will be on this podcast. I guarantee you that. It's not
I
as
doubt it will
interesting.
be. You're the guest that love to bring back.
I'm not as interesting as the other guests, but I got it out there. I gave my piece. I think community is important. So, however that looks to you, you don't have to come to Meat Stock, go to a vegan event. I don't care where you go. Just find like-minded people, and I promise you that will improve your health immensely. And it's something that's so stupid and simple, but it's such a massive component to your overall health and I think longevity. Go out there, be with people, however that looks to you. And if you want to come to Meat Stock, great. If you want to drink my electrolytes, I'll give you, a big hug if you do that for me, because I do have my new business out, which I launched at Hack Your Health. And that was another great event, Hack Your Health, if you guys want to check that out. But there's so many great carnivore events out there. The Healing Humanity Boys got all sorts of cool events going on. There's low carb for better health. I'm going to low carb Boca. Are you going there in
I'll
January?
see you there.
Yeah, low carb Boca in January. You could check that out. There's a lot of cool events. Oh, my friend Melissa, she has a really cool event in Australia. If you guys are looking at travel, she has a wicked carnivore event. I think Dr. Baker is going there and a few other people. Keep your eye out. Just go to a couple different events. And I guarantee you, if you guys are listening to this, you're still listening to me, which God help me, I bet very few of you are at this point. But if you are still listening
We'll
to me,
check the stats here and say, okay,
if we
Scott,
live,
did people bail on? No, we're not live,
no,
but
we're
I
not
can
live.
check. I have the stats available after it's all said and done.
Oh God. Let me tell you. So if I don't even know what I'm saying anymore, I just rant. But yeah, if you guys go to a couple different events, for those of you who have health issues and you don't come back feeling a little bit better, then don't go. But I guarantee you that most of you guys, you're going to go to an event, you're going to be around people you enjoy, you're going to be stimulating conversation, your endorphins, your adrenaline's going to start getting going, and you're going to feel like $1,000,000. And you're going to say, I want to keep doing this. You're going to go on a high, you're going to keep doing it. And eventually you're going to be an event junkie like myself and Dr. Vadi are. So,
Event junkie.
so anyway. I really appreciate you guys. Thank you so much. It's been a real honor, and I think what you guys are doing is so great. And I'm really looking forward to getting your new book, Dr. Vadia. And we should go grab a steak because you just live down the street from me, pretty much.
Sounds like a plan.
Yeah.
All right. Our guest has been Scott Everson, the founder of Meat Stock, and Liv Salter, SALTR.com. Meatstockconvention.com is the website to get tickets for the May event. I think he said the first 50 people who sign up and use the code IFIXHEARTS will also get a copy of Dr. Ovadia's new book once
Paid
it's
for
released.
by yours truly, and when it gets released, you will receive it. So you guys
All
can,
right.
yeah.
I've got a bunch more things I want to ask you, but I may have to do it in person. I think it'd be fun.
Absolutely. Yeah. Come see me in person. Where do you live, Jack?
I'm in Phoenix.
Phoenix. Okay.
Yep.
Good place. I'd love to go there. No rain in the spring and summer. Is that right?
We have hardly any rain ever.
Hardly any rain ever. Sounds like my kind of place.
We average about 5 inches of rain a year.
Oh, wow. That's a good place to have an outdoor convention then, isn't it?
It's a great place after the middle of October.
All right.
It's paradise right now. You don't want to be here in July or June or August or September.
Yeah, same here.
All right.
All right.
For Scott Everson and Dr. Philip Ovadia, this has been Stay Off My Operating Table. All the things that we've referenced on this podcast will also be linked in the show notes. Thanks for joining us, and we look forward to seeing you next time.
Bye, guys. Thank you.
Chances are you wouldn't be listening to this podcast if you didn't need to change your life and get healthier. So take action right now. Book a call with Dr. Ovadia's team. One small step in the right direction is all it takes to get started. Contact us at ifixhearts.com/talk. That's ifixhearts.com/talk.